Okay, thank you so much. My name is Kayoko Shioda. I'm an assistant professor in global health, and I also co-direct the One Health Climate Change and EID cohort seed with David under his leadership. So I work on One Health, and these are the photos from Mozambique where I work. And our studies focus on chickens because chickens are promoted as a development strategy in many of the low and middle income countries, including Mozambique. And the chickens are a very important source of income and animal protein and nutrition. So chickens are great, but at the same time, they are the major reservoir for the important pathogens such as Campylobacter and Salmonella. So we wanted to understand the risk of zoonotic pathogen transmission along food systems in Mozambique. Because in Mozambique, the majority of the people purchase chickens and their products from the informal setting without any regulations. So we didn't know how eggs are transported from here to there, or chicks and chickens and meat. So we conducted the interviews to understand how it works in Mozambique. And I know you can't see it very well here, but then the message is it was super complicated. The eggs are coming from the breeders and then go to hatchery and go to depot and small scale farms, live informal wet markets and street stores and so on. So it was really great that we were able to map that kind of chicken value chain. And then we also identified where children are exposed to chickens and their feces. And there are quite a bit of places that they had some risk of transmission. And then we collected chicken feces and carcass rinse samples and tested them for Campylobacter and Salmonella. And what we found was that the contamination level increased as chickens progressed along the value chain. So it was zero when we tested it at the depot where chicks are raised, but then it increased from 0 to 60% when they moved to the small scale farms, and it reached 100% at the informal wet markets. And then we developed the transmission dynamic model, which looks a little bit complicated, but it basically can simulate the number of cases that are infected from the person-to-person transmission or water, food, soil, animals. And we were able to simulate the potential impact of the interventions targeting different pathways, water pathway, food pathway, animal pathway, and so on. And an example of the result is that if we can reduce the foodborne pathway by 50%, we can decrease the total Campylobacter infection by 30%. And then, I didn't know I included the animation, but then Campylobacter and Salmonella can be transmitted not directly from person to person, but through the contaminated water and food and so on. So it's really important to understand how many of them are coming from each pathway and how that is affected by weather and season and climate. So we're hoping to collect the data on exposure sources and the seasonal drivers and then put them into the modeling to understand or identify climate resilient control measures tailored to this context in Mozambique. And this is the recent project where we started working on with Dr. Warren Kaplan and David. But we're interested in the impact of extreme weather events and natural disasters on diseases and also medicine use and delivery. And I'm so new to the BU. This is actually the final week of my first year at BU. So I'm so looking for new collaborations within BU. So thank you so much for having me here. And I'm looking forward to talking with you all after the event. Thank you so much.